we have started from today a new series on CGHS digital initiatives. यानी कि CGHS में जो IT related, computer related या mobile related सुविधाएं जो लाभार्थियों के लिए हम available करा रहे हैं, उसके बारे में हम सेशंस लेंगे. तो प्लान हमारा ये है कि हर थर्ड ट्यूसडे महीने का डिजिटल इनिशिएटिव्स पे एक वेबिनार होगा. तो उसका आज हम प्रारंभ करने जा रहे हैं. द फर्स्ट सेशन इन दिस सीरीज इज ऑन द CGHS website. We have with us Dr. Lisha Dharan ma'am, who is the Nodal Officer of Monitoring, Computerization and Training Cell in CGHS, and she will be taking a demonstration walkthrough through the CGHS website. We shall be focusing on where the information in the CGHS website is made available, how to access those information such as a list of empaneled hospitals or applying for plastic cards or contact details of CGHS wellness centers, etc. So all that shall be addressed in today's session. Without further ado, I request ma'am to begin the session. Ma'am, please.
Good afternoon, respected everyone, our beneficiaries, CGHS employees, additional directors. There is some issue regarding this sharing. Yeah, so good evening, everyone. Good evening. We will be starting the webinar. It will be a walk through the CGHS website. As you all know, CGHS was started in the year 1954, and as early as the year 2006, we computerized our healthcare services. Over the years, we have introduced several new digital initiatives for our beneficiaries for ease of service delivery, such as the online appointment system, the eCGHS card, MyCGHS app, etc. मगर somewhere down the line शायद हम ये information अपने beneficiaries तक पूरी तरह इन initiatives के बारे में नहीं दे पाए. हम OMs निकालते थे, SMSs भेजते थे beneficiaries को, लेकिन ये इसलिए ये initiatives क्योंकि हम hand holding नहीं करते थे इन initiatives को लेके, इसलिए शायद हमारे बेनिफिशरीज इन इनिशिएटिव्स को उस हद तक नहीं यूज कर रहे जितना कि हम चाहते थे कि वो इन्हें करें. सो देर से ही सही, लाइक वी से बेटर लेट देन नेवर, या जैसे जब जागो तभी सवेरा. तो हमने इस इनिशिएटिव वेबिनार के इन इनिशिएटिव्स को शुरू किया है, वेयर बाय वी विल बी हैंड होल्डिंग यू. आप लोगों को हमारे जो जितने डिजिटल इनिशिएटिव्स हैं उनके बारे में हम बताएंगे, सो दैट आप इन्हें यूज करें. और दिस इज बेसिकली डेवलप फॉर यू पीपल ओनली. सो वी आर होपिंग दैट थ्रू दीज वेबिनार्स, थ्रू दीज हैंड होल्डिंग सेशंस, we will be able to tell you how to use these services better. Now, like I had put in the message, if you are logged in through your mobile, I would request you कि आप अपने desktop से log in करें, so that आपको बड़ा screen मिलेगा और आप इनको बेहतर इन जो icons मैं आपको बताऊंगी उनको आप ज़्यादा अच्छे से देख पाएंगे, and you'll be able to understand the various facilities that we are providing through the website better. एक चीज मैं आप लोगों को, क्योंकि आप लोग इतनी संख्या में हमारे साथ जुड़े हैं, कुछ चीजें मैं आपको बताना चाहूंगी जो आपके फायदे के लिए हैं. फॉर इंस्टेंस, आपके जितनी बेनिफिशरीज के मोबाइल नंबर्स और ईमेल आईडीज हैं, आप यदि इनको अपनी डेटाबेस के साथ मैप करेंगे तो ज्यादा बेहतर रहेगा, बिकॉज इन फ्यूचर देर आर अ लॉट ऑफ सर्विसेज दैट वी प्लान टू प्रोवाइड टू यू थ्रू दीज, थ्रू योर मोबाइल नंबर एंड थ्रू योर ईमेल. फॉर एग्जांपल, जैसे आपकी रेफरल स्लिप है या आपकी प्रिस्क्रिप्शन है, यदि आप अपनी ईमेल आईडी को अपने डेटाबेस में मैप करें, ये आप खुद भी कर सकते हैं या अपने डिस्पेंसरी के इंचार्ज के थ्रू करवा सकते हैं. You will be able to get your prescriptions, your referrals through your email ID. So it will be a permanent record for you. It will be of help to you. So जितना ज़्यादा हो सके आप अपने please mobile numbers को और email IDs को map करें. एक चीज और बताना चाहूंगी कि coming through the walkthrough, if you can see my screen, this is the address that you have to type in: cghs.gov.in. I hope the screen is visible to you. Yes, this first screen that you see on this page is regarding the local and the zonal advisory committees in CGHS. इनके बारे में आपको SMS जरूर मिली होंगी. So I hope you are aware of these advisory committees. ये local advisory committee आपके dispensaries में हर second Saturday को hold होती है, the in charges की chairmanship में. And the local zonal advisory committees जो हैं वो fourth Saturday को आपके AD office में convene होता है. So please do bring in, if you have grievances regarding any issue regarding the services in CGHS, you can bring up your grievances through these local advisory committees. Besides grievances, आपके पास अगर जैसे आपका medical reimbursement claim के regarding आपकी कोई queries है, you can raise. Besides grievances, please make sure to bring in suggestions on how to improve CGHS. So please use this platform that we have provided in all the wellness centers to bring in your suggestions. We are here to listen to your suggestions, and if they are good enough, definitely they will be implemented also. This information we do display on our website regarding the webinars. आपको पता ही होगा, every second Tuesday, third Tuesday, and fourth Tuesday we hold webinars for our beneficiaries, and this information comes to you through SMSs also. So coming to the proper website now, if you see on the top right corner, on the top left corner, we have written this number, which is the toll-free number. And this toll-free number is of our call center. Please use this toll-free number for redressal of, to guide you regarding the grievances that you may be having, to find out about the location of a wellness center, or to find out various services that we provide in CGHS. So do remember to use this toll-free number whenever you need any information regarding CGHS. Then there is one screen reader access. This is for the visually impaired persons who may be wanting to visit the website. And these are some free websites which you can access, and this will help the visually impaired persons to see the website better, to see the contents or read the contents of the website better. If you need to see the website in Hindi, you can click on Hindi, and some of the contents, as you can see the headings which are coming up in Hindi. Going back to the English content. If you see on the top left corner, we have this search box, and you must use this search box to the maximum extent possible, because this is the simplest way to access information. For example, if I type card in here and I search for card, then result for card, almost all the OMs and whatever information is available on the website कार्ड के रिलेशन में, वो सारा आपको एक ही बारी में ओपन होके दिख जाएगा. So please use this search engine to the maximum extent possible. For example, if I put an entitlement, here are all the OMs or the orders which are related to entitlement, which will open up in one go. So for ease of search, this will be the best possible way. Now coming to the different headings that we have on our website. This is CGHS at a glance, which tells you in brief about CGHS, about what are the facilities that are available in CGHS. Coming to CGHS organogram. This is the hierarchy. This is how CGHS works. इसमें कुछ कंफ्यूजन जो लोगों को रहता है वो ये कि एडिशनल डायरेक्टर हेडक्वार्टर इज द पर्सन हु लुक्स आफ्टर द एंटायर वर्किंग ऑफ CGHS, but additional director headquarter deals with CGHS Delhi alone. We have the additional DDG headquarter who looks after the outside Delhi city matters. So that may be of some help to you. Otherwise, this is the organogram. This is our hierarchy that we follow in CGHS. Coming to the facilities available under CGHS, ये एक राइट अप है हमारी जो फैसिलिटी CGHS में आपको मिलती है उसके बारे में. Eligibility for joining CGHS, if anyone wants to know about who all are eligible for CGHS, वो यहाँ पे listed है. CGHS covered cities. These are the list of 79 cities जिसमें आज की डेट में CGHS facilities available हैं. उसके अलावा about the wellness center timings, registration, what is the CGHS contribution and entitlement, हमारी interactive online services क्या क्या हैं वो हमने यहाँ पे enlist की हुई हैं. And this is about the 24/7 national CGHS helpline जिसके बारे में मैंने आपको बताया ही था शुरुआत में, जिसका ये नंबर है. आपका एक बहुत important information का पार्ट है beneficiary corner. इसमें I think most of the information which a beneficiary requires in detail इस heading के अंदर आपको मिल जाएगा. Frequently answered questions. इसमें search facility है. For example, आप अगर empaneled hospital के बारे में डालते हैं and you search here, then all the FAQs that are related to empaneled hospital वो एक ही बारी में खुल के आ जाएंगे आपके पास. So you can open each one of them and look for the details. What are the guidelines for specialist consultation from CGHS empaneled hospital? Or this is the question and उसका detailed answer and उसके जो related office memoranda है वो भी आपको यहाँ पे मिल जाएंगे. So similarly, whatever, suppose it is referral के बारे में आपको जानना है, what are the commonly asked questions regarding referral? You just type in referral and search again. And these are the queries जो FAQs आपको referral के बारे में है वो सारे. What is the referral letter? What if the treatment proposed through referral letter differs from the treatment packages? So the quite a lot of questions that are commonly asked regarding referral, you will find them all here. Their answers on clicking them. And if there is a related OM, वो भी वहाँ खुल के आ जाएगा. So please use the FAQs to the maximum extent possible. आपकी बहुत सारी queries की replies आपको यहाँ पे मिल जाएंगी. This is in detail about procedure for availing CGHS facilities जो हमारी normally CGHS wellness centers में available हैं facilities उनके बारे में. How to apply for CGHS card, procedure for getting a CGHS card, serving employee के लिए कौन कौन से documents लगाने पड़ते हैं, pensioner है तो क्या क्या documents लगाने पड़ते हैं, dependency criteria क्या है, what is the definition of dependency, channel of submission, serving beneficiary है तो वो application किस तरह से submit करेगा, pensioner है तो उनको किस तरह से submit करना है, and the entire details are given in this. Addition deletion कौन कर सकता है, validity of a CGHS card, how to transfer card, self printing card, printing your own card, how do you print your own card, वो सारी details इसमें दी हुई हैं. One of the latest ones that we had issued is regarding Aadhaar number and Aadhaar address. Quite a few beneficiaries had this apprehension that अगर हम अपना आभा नंबर क्रिएट कर लेंगे और उसको CGHS बेन आईडी के साथ लिंक करेंगे तो हो सकता है हमारा जो है CGHS की फैसिलिटीज बंद हो जाएं and we'll probably all be shifted to the PMJAY. हमारी CGHS की OPD फैसिलिटी सब बंद हो जाएंगी, बट ऐसा नहीं है. In the days to come, आभा नंबर को CGHS के साथ लिंक करने से आपको बहुत सारे फायदे मिलेंगे. Already हमारी जो wellness centers हैं, they have started the process of creating their health facility IDs and the doctors their health professional registry IDs. Very soon आपके जो treatment papers हैं that will be portable from one wellness center to another and once the private and panel hospitals also onboard the ABDM, आपकी रिपोर्ट्स भी एक हॉस्पिटल से दूसरे हॉस्पिटल में या वेलनेस सेंटर में पोर्ट हो जाएंगी, ऑफ कोर्स विद द परमिशन, आपकी परमिशन के साथ ही होगा, आपके कंसेंट के साथ ही होगा। तो आपको अपनी रिपोर्ट्स अपने साथ कैरी करने की जरूरत नहीं पड़ेगी। अनदर फैसिलिटी जो हम खोलने की सोच रहे हैं वो है आभा शेयर, स्कैन एंड शेयर। वेलनेस सेंटर्स में क्यूआर कोड्स लगाए जाएंगे, तो आपके पास आभा नंबर है तो यू जस्ट हैव टू स्कैन दैट आईडी और आपका रजिस्ट्रेशन प्रोसेस विदाउट स्टैंडिंग इन द क्यू हो जाएगा। सो यू विल बी स्पेयर्ड ऑफ द हैसल ऑफ स्टैंडिंग इन लाइंस इफ यू हैव एन आभा नंबर। So please come forward and link your Aadhaar number with the CGHS beneficiary ID. The entire process is explained कि किस तरह से आपको ये करना है. It is not very difficult, so we urge you to please come forward and do this. It is only for your benefit. Then the others, procedure for referral, investigations and treatment, hospitalization, reimbursement of medical claims को आप जरूर देखिएगा. It's a very detailed document कि किस तरह से आपको क्लेम सबमिट करना है। ये पेंशनर्स के लिए तो है ही, क्योंकि पेंशनर्स हमारी डिस्पेंसरीज में क्लेम को सबमिट करेंगे, बट दिस विल ऑल्सो सर्व एज गाइडलाइंस फॉर सर्विंग बेनिफिशरीज। उनके जब ऑफिस में उनको जमा कराना है, बिकॉज गाइडलाइंस फॉलोड आर द सेम। स्पेशल केसेस के लिए क्या क्या, दीज तो ये ऊपर जो लिखी हुई है 1 to 13, दीज आर ऑल रिगार्डिंग व्हाट इज टू बी सबमिटेड फॉर अ जनरल मेडिकल रियम्बर्समेंट क्लेम। उसके अलावा स्पेशल केसेस, फॉर एग्जांपल अगर आपका बिल खो गया तो देन व्हाट इज रिक्वायर्ड, या डेथ ऑफ द मेन कार्ड होल्डर है तो व्हाट आर द रिक्वायरमेंट्स, कैटरेक्ट सर्जरी है तो व्हाट आर द डॉक्यूमेंट्स जो चाहिए, कार्डियोवैस्कुलर स्टेंट्स लगी है किसी केस में तो उसमें क्या क्या सर्टिफिकेट्स और डॉक्यूमेंट्स की रिक्वायरमेंट है, पेसमेकर के केस में क्या क्या लगाना है, एम्बुलेंस अगर यूज किया गया है तो तब क्या करना है। So almost all the details are given here. If you are aware of the documents which are to be submitted with your medical claim, उसका फायदा ये होगा कि आपका जो medical claim है वो pending में नहीं पड़ा रहेगा, because you would have already submitted the documents required. So please go through this and this will be a good guide to you about what all are to be submitted when you submit your medical reimbursement claim. टेली कंसल्टेशन सर्विसेज इज रिगार्डिंग द ई संजीवनी, उस पे हम एक डिटेल्ड वेबिनार आगे लेंगे। From now onwards, every third Tuesday, we are going to have this webinar and we will be walking you through the different facilities. तो उनमें से एक ई संजीवनी पे भी हम एक webinar लेंगे. We'll be explaining that to you in detail during that time. We will be talking about the beneficiary login. ये आप बहुत सारे beneficiaries हो सकता है यूज कर ही रहे होंगे आपका मोबाइल नंबर अपडेट करने के लिए या आपका ईमेल आईडी अपडेट करने के लिए. We will be giving you a walk through the beneficiary login, not in this webinar, but in the subsequent ones, because this is going to take time. How to apply for CGHS plastic card, आपका वो सारा डिटेल इसमें आ जाएगा. Book online appointment, this is again going to be another webinar. Somehow our beneficiaries do not use the online appointment to the extent that we would want them to. शायद इसलिए कि ये प्रोसेस शायद समझ नहीं पाए हैं कि किस तरह से इसको करना है. We will be explaining this also in detail in our subsequent webinars. This is the local advisory medical reimbursement claim status. We have started the process of updating this from various cities. तो इसमें आपकी सिटी वाइज आपको इंफॉर्मेशन मिल जाएगी. फॉर एग्जांपल, नागपुर हैज गिवन अस द स्टेटस ऑफ अप्रैल 2023. सो इस तरह से पेंशनर्स कैन सर्च. सपोज देयर इज अ पेंशनर इन नागपुर हु वांट्स टू नो अबाउट द स्टेटस ऑफ हिज क्लेम, वो अपना सर्च कर लें, यहाँ पे अपने बेन आईडी से सर्च कर लें एंड ही विल नो व्हाट इज द स्टेटस ऑफ द क्लेम. This table will give you information about what all has been processed. If you can see the heading, it says processed and sent to the PAO. This is for the month of April. उसके बाद there is a second table जो अब pending पड़ी हुई हैं and the reasons why they are pending. That information and for how many days they are pending. So this information city wise is available. कुछ कुछ सिटीज की अभी आई है, एंड सून द अदर एडिशनल डायरेक्टर्स और सिटीज विल बी शेयरिंग देयर इंफॉर्मेशन. We will be updating this soon, and you will be getting your information regarding the status of medical reimbursement claims. In addition, this is regarding the local advisory committee and the zonal advisory committee. इसमें हर सिटी के local advisory और zonal advisory committee की आपको details मिल जाएंगी as to who all are the members in that committee. लोकल एडवाइजरी कमेटी फॉर एग्जांपल ये हैदराबाद का है. ये जो नोटिफाई हुए हैं मेंबर्स, उनकी डिटेल्स आपको मिल जाएंगी इसमें. So like I had mentioned earlier also, please use this facility, this platform that we have given for beneficiaries and the CGHS to come together and work together for the CGHS, not just for resolution of your grievances, but also please come forward. और आपकी जो suggestions हैं CGHS wellness centers को किस तरह से हम improve कर सकते हैं, please come up with your suggestions. क्योंकि CGHS जितना हमारा है उतना हमारे beneficiaries का भी है. So please come forward, give your suggestions. Most welcome on that. This is empaneled and diagnostic centers के बारे में. City wise empaneled hospitals and diagnostic centers के rates आपको मिल जाएंगे. इसमें for example, if I go to Delhi, empaneled hospitals and diagnostic centers, yes, इसमें जो लिस्ट ऑफ empaneled hospitals का जो लेटेस्ट ऑर्डर है आप उसको ढूंढिएगा. इन एडिशन देयर वुड बी ऑर्डर्स. अगर एक आध जो लिस्ट है इसको अपडेट होने में थोड़ा सा टाइम लगता है, बिकॉज समटाइम्स maybe just 1 or 2 hospitals are newly notified, and for that to be added to the compiled list of empaneled hospitals, that may take some time. So please do see the other orders that are there. For example, 6th of April ke baad there are 1 or 2 hospitals which have been added. For example, the Sarvodaya Hospital under CGHS Delhi NCR added on 12th of May 2023. So do look for the orders also, individual orders also, because this list is updated say once in a month or maybe once in 2 months. So do look around for these orders also. They will give you the information about the hospitals that have been latest empaneled or depaneled from the list of hospitals. Search location mein, if you can see, these are all the geolocations of various CGHS wellness centers. So you can search them with the help of this. You'll have to put in the district, say for example central, and it will give you information about the wellness centers which are located in the central part of Delhi. So you can use that. Going back to this, how do you search for empaneled hospitals and diagnostic centers? यहाँ पे suppose you want to search for a particular hospital, you can select the city, say for example Bangalore, and these are the list of hospitals which are available in Bangalore. You want to know, say for example, Dr. Solanki Eye Hospital, or maybe Bangalore West Line Super Specialty Hospital, or let's go to some other hospital. Yeah, say MS Ramaiah Hospital. And you want to know what are the facilities that it is empaneled for, just click on submit. And here you will find what are all the specialties that it is empaneled for. So this is a search facility for the empaneled hospital. Similarly, if you want to search for the rates, you can do so. Now, this is the compiled list of all the webinars that we have conducted so far for CGHS beneficiaries since the year 2021. And these are all बहुत simple तरीके से PowerPoint presentations बनाई गई हैं common ailments के बारे में, जिसमें beneficiary के लिए lucid language में, simple language में इंफॉर्मेशन दिया गया है. अगर आप इनको अटेंड कर रहे हैं रेगुलरली, वेल एंड गुड. नहीं तो आपने इनको मिस किया है तो प्लीज यू कैन गो थ्रू दीज वेबिनार्स and you will get a lot of information regarding how to manage your lifestyle. अगर disease है तो उसको किस तरह से manage करना है, how to prevent those diseases at the beneficiary level. A lot of information, a wealth of information, I should say. Similarly, if you scroll down, इनके webinars भी आपको videos भी आपको मिल जाएंगे. Although videos we have not been able to upload all of them, but quite a few of them are definitely available. So live आपको ये दिख जाएंगी. This will take some time to upload because obviously heavy files हैं ये. So you can play these webinars, you can choose whichever you want to see, and so we have a good repository of webinar as videos also. Now coming to downloads, इसमें आपको application forms मिल जाएंगी जो commonly beneficiary के जरूरत की हैं. जैसे ये application for CGHS plastic card है. Then you have medical reimbursement claim forms, mandate form for individuals जो medical claim के साथ लगती हैं. Utilization certificate, जब आप कोई महंगी दवाई लेते हैं CGHS से, so normally this is required before you submit your next requisition for an expensive medicine. So this copy is also available here. उसके अलावा ये है certificates for quite a few beneficiaries may be wanting oxygen concentrators or CPAP machine or BiPAP machine. So these certificates of necessity जो कि specialist को भर के देनी होती है, these are also available here. They can be downloaded from here. Beneficiary को जब ये if any beneficiary wants to get an oxygen concentrator, CPAP or a BiPAP machine, then एक ये checklist उनके काम की चीज है. So they can see what all are the documents which are required जब आपको oxygen concentrator की जरूरत होती है. This again, इससे जो है आपको बार बार ऊपर नीचे भागना नहीं पड़ेगा. आप वेलनेस सेंटर में गए, कुछ डॉक्यूमेंट्स दिए, कुछ नहीं दिए, फिर इंचार्ज ने कहा कि आप ये ले आइए, इसकी भी जरूरत है. So if you go through this checklist, you will know what all are the documents which are required for these devices with that you may be needing. उसके अलावा कुछ एफिडेविट्स भी हैं जो आपको इनके साथ लगा के देनी होती है when you apply for oxygen concentrators, CPAP and BiPAP machines. तो वो भी आपको यहाँ से मिल जाएंगी. So as I said, a lot of applications, the forms are available on the website जो कि आप directly यहाँ से ले सकते हैं. Related links में अभी हमने recently ये link डाला है regarding CSMA. CSMA की वेबसाइट पे ये आपको डायरेक्टली लेके जाएगा. CSMA के जो recent orders हैं वो सब आपको यहाँ पे मिल जाएंगी. In addition, जो CSMA की list of empaneled hospitals हैं वो state wise आपको यहाँ पे दिख जाएंगी. So those beneficiaries who would like who are eligible for CSMA facilities, उनके लिए ये डायरेक्टली लिंक अभी हमने रिसेंटली ही डाला हुआ है. दिस इज द जनौषधि ब्रोशर. बहुत सारे हमारे मरीजों के मन में जनौषधि को लेके बहुत शंकाएं हैं. उनको लगता है कि शायद जेनरिक मेडिसिन की क्वालिटी अच्छी नहीं है. So I would request them to go through this detailed brochure regarding the जनौषधि medicines. And आप ये देख सकते हैं कि कितनी levels of testing के बाद जनौषधि दवाइयाँ आप तक पहुंचती हैं. So this will kind of build confidence regarding the Janaushadhi medicines. So please do take time to go through these Janaushadhi ka brochure. This takes you to the CGHS dashboard. We'll talk about the dashboard in the later webinars. This may not be of so much use to the beneficiary as it is for our own CGHS officers for monitoring purposes. These are the formulary of medicines in CGHS. बहुत बारी आपको शंका होती है कि भी CGHS डिस्पेंसरी हमें ये दवाई क्यों नहीं देती है. इंचार्ज बोलता है कि भाई ये फॉर्मुलरी के बाहर है, हम आपको नहीं दे सकते. So this is the list of formulary medicines. Interested people can go through this. Regarding grievances, ये हमारा CGHS का अपना बना हुआ ग्रीवेंस पोर्टल है. इसके भी वॉक थ्रू हम आपको करवाएंगे इन वन ऑफ दी वेबिनार्स दैट वी प्लान टू डू फॉर यू इन फ्यूचर. इसका सबसे एक पॉजिटिव जो है, स्ट्रॉन्ग पॉइंट जो है वो ये है कि आपकी जो ग्रीवेंस है वो सब्जेक्ट वाइज मैप्ड है. सपोज इट इज वेलनेस सेंटर रिलेटेड ग्रीवेंस, तो जिस भी वेलनेस सेंटर को आप चूज करेंगे this is mapped to the in charge of that wellness center. तो जैसे ही आप ग्रीवेंस इस पोर्टल पे अपना लॉन्च करेंगे, वो तुरंत ही रियल टाइम में उस इंचार्ज के पास पहुंच जाएगा, एंड इट शोज अप इन हिज मॉड्यूल, एंड इंचार्ज इज सपोज टू रिप्लाई टू दिस विद इन 3 days टाइम. सो एक तो लॉट ऑफ टाइम जो नॉर्मली वेस्ट होता है इन पुटिंग इन अ ग्रीवेंस का लेटर, इट गोज टू द हायर ऑफिसर एंड देन इट ट्रेवल्स डाउन टू द लोअर ऑफिसर एंड देन द ग्रीवेंस गेट्स रिड्रेस्ड. तो इस पोर्टल के माध्यम से वी हैव ट्राइड टू रिड्यूस द टाइम टेकन फॉर ग्रीवेंस रिड्रेसल. इसमें देर इज ऑल्सो अ प्रोविजन फॉर पुटिंग इन योर सजेशंस. तो आपकी सजेशंस कुछ हैं तो उसके लिए भी आप इसको यूज करें. We will be giving you a detailed walkthrough through this grievance portal also in one of our later webinars. This of course is the CP Grams portal. इसके बारे में तो आपको पता ही होगा. And this is regarding the complaint and grievance redressal जो हम CGHS में follow करते हैं. This is about that. RTI में आपको different cities के जो Central Public Information Officers हैं उनके बारे में, और उनके जो appellate authorities हैं उनके बारे में आपको information है. City wise list हमने यहाँ पे डाला हुआ है. Then comes the CGHS cities. काफी सारे beneficiaries को इस बात से problem था कि जो CGHS cities की अपनी individual websites थी, those have been taken down and this common website is now there. City wise website अलग से अब नहीं है. Actually, it was a requirement of the MOHFW कि एक single main website MOHFW की रहे and department उसका subdomain रहे, उसके अलावा और subdomains ना हो, for better monitoring and better flow of information. So it was the request of some of the additional directors कि उनकी city specific information के लिए कुछ provision दिया जाए website पे, which is why we have given this. But abhi tak, since no AD has given us city specific information to be uploaded here, these are right now empty. But if ever we do realize, we do get information, city specific orders or any circulars, which an additional director wants to share with the beneficiaries, तब हम इसको इस पे upload करेंगे. Another thing जो आप लोगों को बहुत extensively use करना चाहिए वो है हमारा contact list, जिसमें हमने पूरी detail में दी हुई है. For example, outside Delhi अगर मैं contact list खोलूं तो this is the contact detail of the additional deputy director general CGHS, जिनके अंडर 23 cities हैं जो ऑर्गेनोग्राम में हमने आपको दिखाया था, और हर सिटी के एडिशनल डायरेक्टर के ऑफिस की डिटेल्स फॉलोड बाय उनके अंडर जितनी भी वेलनेस सेंटर्स हैं उनकी एड्रेस. हमारी पूरी कोशिश रहती है कि इसको अपडेट रखें टू द एक्सटेंट पॉसिबल. जैसे ही हमारे पास नए वेलनेस सेंटर की इंफॉर्मेशन आती है, we try our level best कि वो उसी टाइम इसमें अपडेट रहे. So I would say 99.9% this is updated. Maybe एक आध दिन का after the dispensary opens, then maybe after a day or two इस पे आता होगा. But yes, 99.9% this is an updated information. You can rely on this. इसमें आपको additional directors के offices के बारे में information पूरी मिल जाएगी, उनका contact number, उनकी email IDs, उनके addresses, and location of their wellness centers. So this entire information is available in this form. इसमें आप search कर सकते हैं Control F करके. You can search, for example, if you want to search for वडोदरा. So ये वडोदरा की dispensary मेरे सामने आ गई है, उसकी email ID ये रही, location ये रहा, और wellness center का नाम ये रहा. तो इससे आपको पता चल जाएगा कि वडोदरा is under the control of additional director अहमदाबाद. So इसकी सर्च ऑप्शन के थ्रू आप किसी भी सिटी में किसी भी वेलनेस सेंटर के बारे में आप ढूंढ सकते हैं. इसमें हमने अपने डायरेक्टोरेट के कॉन्टैक्ट डिटेल्स भी डाले हुए हैं. यहाँ पे भी आपको हायरार्की दिख जाएगी. So do use the contact list extensively. इसमें आपको बहुत सारी information हमारी different officers के बारे में और wellness centers के बारे में मिल जाएगा. This is our citizens charter. इसमें we have tried to project the timeline for delivery of various services in CGHS. So this has been developed as per the framework recommended by Department of Administrative Reforms and Public Grievances. This is the index. These are the services that we render, और इसकी टाइम पीरियड्स हमने लिखी हुई हैं. We try to adhere to those timelines as far as possible. CGHS में आज की डेट में there is staff's crunch, shortage of manpower, but we try as far as possible to settle grievances, settle bills, and do our best possible so that beneficiaries do not face any kind of trouble. These are the circulars. ये हमने सब्जेक्ट वाइज सर्कुलर्स डाले हुए हैं वेबसाइट पे. जैसे मैंने आपको पहले बताया था, rather than going through each of them and trying to search for orders, the best would be कि आप यहाँ पे जाएं और इस सर्च फैसिलिटी को टू द मैक्सिमम एक्सटेंट पॉसिबल सर्च करें. फॉर एग्जाम्पल, अगर मैं हियरिंग एड डालती हूँ यहाँ पे and I want to search for orders related to hearing aid जो भी CGHS ने निकाले हैं. So here are all my latest orders. Checklist for permission, ये रहा जो latest guidelines 1st of December 2020 को निकाली गई थी CGHS में, वो सारा दिख जाएगा. This is the OM जिसमें which are the latest rates, और ये पूरा OM यहाँ पे है. So rather than going through the headings of circulars and trying to search for an OM, आप जो सर्च इंजन है इसको as far as possible यूज करें. ये जो CME है ये हमारे डॉक्टर्स के लिए है. दिस may not be of much use to our beneficiaries. ये उनके वीडियोस और प्रेजेंटेशंस हैं. So that is in short about the CGHS websites. Now Nitya can tell me if there are any queries which have come through the chat box so we can discuss them.
Yes, thank you so much, ma'am, for such an elaborate walkthrough through the CGHS website. We have taken up each menu option and the submenu options under them. So I hope our beneficiaries find it very helpful. We had a few questions in the chat box. So one query was, is there a difference between the CGHS website and the My CGHS app?
या माई CGHS ऐप जो है वो आप अपने मोबाइल पे प्ले स्टोर के थ्रू डाउनलोड करके यूज कर सकते हैं. It is currently not available for the iPhone users because iOS पे अभी Apple Store पे App Store पे available नहीं है. But our team, NIC team, which has designed this website, we are working on it and we are hoping कि maybe in a few months it will be available on the iOS also, क्योंकि बहुत सारे हमारे जो beneficiaries हैं वो आईफोन्स यूज करते हैं. एंड माई CGHS ऐप का भी हम पूरा वेबिनार एक लेंगे एंड इट इज अ वेरी यूजफुल डिवाइस. इट्स अ वेरी यूजफुल एप्लीकेशन. डू यूज इट ऑन योर मोबाइल. उसके थ्रू आप अपने CGHS कार्ड को डाउनलोड कर सकते हैं. तो आपको अपने CGHS कार्ड को फिजिकली ट्रांसपोर्ट करके डिस्पेंसरीज में ले जाने की जरूरत नहीं है. सो दैट्स अ वेरी यूजफुल ऐप. आपको अपने घर के पास में जो क्लोजेस्ट वेलनेस सेंटर ढूंढना है आप उस ऐप के थ्रू ढूंढ सकते हैं. यू कैन सी द डिटेल्स ऑफ मेडिसिन, आपकी मेडिसिन हिस्ट्रीज के बारे में. आप ऑनलाइन अपॉइंटमेंट ले सकते हैं उस ऐप के थ्रू. उसको कैंसिल करना है तो वो कर सकते हैं. एम्पैनल हॉस्पिटल के बारे में आपको जानना है, हॉस्पिटल में क्या क्या फैसिलिटीज अवेलेबल हैं, वो आपको उस ऐप के थ्रू मिल जाएगा. सो अ लॉट ऑफ फैसिलिटीज आर अवेलेबल थ्रू द ऐप. वेबसाइट को एक्सेस करने के लिए आपको कंप्यूटर यूज करना पड़ेगा, which is why at the beginning of this walkthrough I had requested कि आप लोग डेस्कटॉप को यूज करें, बिकॉज इसमें इतनी सारी हेडिंग्स हैं जो आप मोबाइल के थ्रू आप उनको क्लियरली नहीं देख सकते. सो दैट्स द डिफरेंस. एंड नॉट ऑल फैसिलिटीज दैट यू फाइंड ऑन द वेबसाइट, इसमें जितने हेडिंग्स हैं वो सारे का सारा ऐप पे अवेलेबल नहीं है. But a lot of important things are available in the app. So I would urge कि जो Android users हैं, please go to Play Store and My CGHS app को आप download करें. The app में MY is in small letters and the CGHS with no space in between is in capitals. So it is MY small capital CGHS. Use that and download it on your mobile and you will find it very useful.
Thank you, ma'am. We have had a lot of queries regarding where to submit the suggestion and also regarding LAC and ZAC. So, ma'am, can you please run through where to access the details of the local advisory committee and zonal advisory committee, please?
Yeah, the OM on LACZAC will be available here only. These are all for advisory committee. These are all the details. Here it is.
So as we can see, all the details are arranged city-wise. So whichever city they belong to, they can click there and maybe go in for that.
Yes, and this is the office memorandum regarding setting up of advisory grievance committee at dispensary level. So these are all the details regarding the LAGZAC committee. The in-charge area welfare officer, representative from Resident Welfare Association, representative of pensioners, representatives of local chemist, and it will be notified by the additional director. So जो भी OMs हमने डाला हुआ है, हाँ, जो भी हमने details डाला हुआ है, those are all the committees which have been notified by the senior officers. So those are the committees which are actually running in the wellness centers. These are all the terms of reference. What all are the terms of the actions that the committee will be performing? What all they are empowered to do? Like this committee, local advisory, they will be meeting up every second Saturday of the month. They will be studying the grievances and suggestions received in the complaint box. So local advisory committee and the zonal advisory committee are two platforms which have been given for beneficiaries कि beneficiaries अपनी suggestions भी दें, ना केवल grievances but suggestions भी on how to dispensaries में सेवाओं को किस तरह से हम सुधार सकते हैं. So these are the terms of reference for the local advisory committee. इसको आप डिटेल में देख सकते हैं. Just type in advisory committee and ये zonal advisory committee जो कि हर additional director के office में constitute किया गया है. These are the members of the advisory committee at the additional director level, जिसको zonal advisory committee बोलते हैं या ZAC बोलते हैं. You have the officer dealing with the reimbursement of hospital bills, nodal officer for grievances, administrative officer, two representatives of CGHS beneficiaries, empanel hospital के representatives रहेंगे इस पे, area welfare officer रहेंगे, and these will be held every fourth Saturday. इनकी भी जो मैंडेट है वो ये है, डिस्कस इश्यूज ग्रीवेंसेस जो कि डिस्पेंसरी में लोकल एडवाइजरी कमेटी मीटिंग्स के दौरान उठी हैं, उन ग्रीवेंसेस को वो वहां पे नहीं सेटल हो पाई हैं, देन दे विल बी एस्केलेटेड टू द एडिशनल डायरेक्टर्स ऑफिस और उनको वहां सेटल करने की कोशिश की जाएगी. Monitoring of issue regarding cards, monitoring of medical reimbursement claims, pending bills, hospital bills, major repair of wellness centers. जो सजेशंस डिस्पेंसरी लेवल से आई हैं या जो जोनल ऑफिस में ही सजेशंस आई हैं वो टेक अप की जाएंगी. Monitoring of timely issue of pension orders, family pension, this is for the employees of CGHS. Complaints against empanel hospitals, complaints against in charges, adherence to budgetary allocations. The issues that beneficiaries face in empaneled hospitals, these will also be taken up here. So this is the mandate of the local and the zonal advisory committee. Anything else, Nitya?
Yes, ma'am. There were a few queries which I observed that were mostly from satellite cities like Kannur and Kochi and Ambala. They had written that they are not able to track their
Not able to track there? Sound is not coming through. Can you hear? Nitya, your voice is not audible.
I lost connection.
Yeah, you can come here and tell. Yeah.
अंबाला को ये नहीं पता कि वो चंडीगढ़ के अंदर आता है, तो यू नीड टू टेल कि सैटेलाइट सिटी सभी तीन सिटी में सर्च करें और ये नहीं है. So
This is
अंबाला
regarding what?
satellite city and main city.
How do people know okay, which is the satellite city and under which city? Yeah, okay. So we have, for example, I had given you the example of Vadodara, which comes under Ahmedabad. or we have Agra, which comes under Lucknow. For that, you need to go to the contact us, and ये satellite cities का जो है वो that is for outside Delhi cities. दिल्ली में satellite city का concept नहीं है, so you can go to the contact list and you can scroll down to see. Of course, first is Control F, search for Gwalior, or you can search for Ambala. Why is Ambala not coming? Ambala comes under Chandigarh. Hmm. Here is Ambala. Now you can see that Ambala is coming under Chandigarh. And you have Amritsar, Jalandhar, and Srinagar. These are also satellite cities, including Jammu and Shimla, which are coming under Chandigarh. The main city here is Chandigarh, and the rest of them are all satellite cities. They are located outside the city, but for ease of administration, they have all been clubbed under the Additional Director Chandigarh. So, similarly, you have Kannur. Here is Kannur. Kannur comes under Trivandrum, Additional Director Trivandrum. So we have three wellness centers in Trivandrum, which are under the main city, located in the main city of Trivandrum. Then you have Kochi, you have Calicut, and you have Kannur, which are the satellite cities which come under the Additional Director Trivandrum. Is there any other query?
Yeah, we had a few requests regarding having the circulars in Hindi, which
Yes. I don't know if our nodal officer for Hindi is here with us. We have a nodal officer, and yes, she has also expressed that we should have a lot of our OMs in Hindi. And in some of our earlier meetings, the additional directors from outside cities had also expressed this. So right now, very few OMs, I think hardly any are there in Hindi. So I would request the additional directors of cities to send us in Word document the original OM, which is in English. We can get it translated into Hindi, and then after you endorse it, they can be uploaded on the website. So we are working on that.
there were a lot of queries regarding Aadhaar, that is Ayushman Bharat Health Account. So we will be taking a separate session on Aadhaar and we will address those queries at that point.
Yeah, so like I said, and I'm reiterating again, please come forward and link your ABHA number with your CGHS beneficiary ID. The benefits that are going to be coming out of that are tremendous. In the next few months, you will see those changes coming up. आपको लाइंस में खड़े होने की जरूरत नहीं पड़ेगी. You will not have to carry your lab reports with you. Everything with your consent will be visible. Suppose you have done some lab investigation in any laboratory, any private empaneled hospital or lab in Delhi, and then you come to the wellness center, you're showing the doctor wants to know what were your reports, you're not carrying your reports. Then as on date, you will have to go back, collect those reports, and then visit the doctor again. Once you have your ABA ID, and once our wellness centers as well as the private and panel hospital are both onboarded on the ABHA platform, then with your permission, the doctor can access those lab reports. So you can imagine the ease of services, healthcare delivery that is going to take place once you have ABHA numbers linked with your beneficiary ID. So I urge you again, आपसे और फिर request करते हैं कि please आप अपने beneficiary ID और ABHA ID को link करें. इसके बहुत फायदे हैं.
Is there any difference between CGHS and CSMA was a query which a few of our participants have raised.
Yes, CSMA is for those beneficiaries who are living in cities this is for serving beneficiaries. For those beneficiaries who are living in cities which do not have CGHS coverage. हमारी यहाँ पे areas which are covered under CGHS वो आप यहाँ पे देख सकते हैं. हमने कुछ टाइम पहले आपको here it is, CGHS covered cities, the geographical areas covered under wellness centers. तो कौन कौन से एरियाज हैं जो अलग अलग वेलनेस सेंटर्स में के अंडर कवर्ड हैं, वो यहाँ पे दिख जाएंगे. So those serving employees who do not live in areas covered under CGHS, for them the CSMA facilities are there. And I had already shown you CSMA का link हमने अभी recently दिया हुआ है. So उसमें जो CSMA के latest orders हैं, list of empaneled hospitals हैं, all those you can access through this link. It takes you directly to the CSMA website. Any other query, Ditya?
Just a second. I'll just go through it. No. There were a few queries regarding the plastic card and renewal. So maybe you can show where the option of renewal of plastic card and the information related to that is in the website once again, please.
Application for CGHS cards.
And it's
Yes, this is application for new CGHS card, and this is application for renewal of plastic card for pensioners and those for serving employees. So downloads के अंदर जो आपका application form है, इसमें आपको वो information मिल जाएगा. And regarding plastic cards, I'm sure all of you are aware of the e-print card facility. So please आप कार्ड को अप्लाई करने के बाद जैसे ही आपके पास वो SMS वेरिफिकेशन आता है that your card application has been verified, you need not wait for the plastic card to be issued. That will take time. आपके पास वो CGHS की कार्ड डाउनलोड करने की फैसिलिटी है जो कि आप बेनिफिशियरी लॉगिन के थ्रू कर सकते हैं. प्लस आपके पास अगर मोबाइल ऐप है तो आप उसमें अपना CGHS कार्ड एक्सेस कर पाते हैं. So you need not wait for the plastic card to be issued. आपकी CGHS services उससे पहले ही शुरू कर सकते हैं आप through these online modalities.
Yes, thank you, ma'am. That wraps up the queries that we had on the chat box. I request every beneficiary who have suggestions with respect to improving the CGHS system, as a few suggestions have come on the chat box, they may please submit it to the local advisory committee and zonal advisory committee so that it can be considered and implemented if feasible. I thank Dr. Lisha for such a wonderful and detailed presentation and walkthrough through the CGHS website where we can access many information pertaining to CGHS. I thank our participants for their active interaction. And we wrap up this session today, but the next session on digital initiatives in CGHS is scheduled for the 20th of June, where we will take up another topic pertaining to digital initiatives. So till then, thank you everyone and take care.
Thank you.
We will conclude this.